Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today's Wednesday, January 13th, giving you the update from Albany Med. All right, Fred, we missed yesterday. That was my fault. We had to reschedule, but we're here today.
A lot of things going on.
A lot of things going on. Let's talk about them. First graph, Capital Region, people in the hospitals of the Capital Region with COVID. That number is 525. Graph is, you can see that there. Let's look at the next graph here. This is admissions and discharges to the medical center here. And what I would point out is lately we've been kind of balancing the number that are admitted are about the same number as being discharged.
We've been hovering plus or minus 5 to 8, Dennis, for about a week now.
Right.
Yeah, so we are plateaued a little bit.
And Fred, you and others predicted, I think accurately, that this is probably what we would see after the holiday season, that it would be this week when things would have numbers similar to this.
Right. That's right, Dennis.
Okay. And then still we point out there's no influenza activity on that graph.
Pretty remarkable.
So let's look at the morning census here on this campus. We have 139. The breakdown is we have 18 in the ICU, 7 on a ventilator. So let's talk about that. If we look at that graph, Fred, it's not a week's worth of data, it's not 2 weeks worth of data, but the last couple days at least, it appears to have some plateau. So we always look for good news when there is some. It's not going up, it's staying relatively flat the last couple days.
That's right, Dennis, it is.
Yeah.
And for the region, you know, probably the last 4 or 5 days we've been hovering as well. So that's good news too.
Let's talk a little bit about what's inside those numbers as well. Only 7 on a ventilator, a very small percentage compared to what we would have expected back in April or May. Any thoughts on that, Fred?
Well, I think, Dennis, we're doing a number of things that perhaps are helpful. So first of all, we use convalescent plasma very early in the course. And there's now data, there's information, we talked about it on this video last week, that suggests early use, particularly in the elderly, prevents progression to severe pulmonary disease. So I think that's part of it. And I think our guys have also been very aggressive with other therapies, high flow oxygen, proning, some other meds that are available, and that's perhaps actually helping.
For sure. Fred, speaking about articles in the different journals out there, there was an article that you were talking about today that was published in Science, and this really speaks about immunity, and perhaps more importantly, how long will that last? And you wanted to share that.
Yeah, so this is a very interesting article. It's from the La Jolla Institute out in San Diego, which is a very well-respected institute. They actually looked at about 250 patients from Mount Sinai and looked at how long the 3 different types of immunity lasts in their bloodstream. So there are 2 different types of white blood cells, B cells, and T cells, and then they also looked at the antibody for the spike protein. And interesting, Dennis, they last at least 6 months, and in some cases they even had samples from 8 months out where there were still large titers of all of those. So that's very, very positive news. It suggests that if you get the infection, you're going to be protected from getting it again.
And we certainly hope that's the case with the vaccine as well, that immunity will last. Fred, let's talk a little bit more about that. So we listen to a lot of numbers every day. One of the numbers we listen very carefully to is of our employees who go in and get tested at Employee Health Service to see if they have COVID, what percentage of them are positive? And we know that more often than not, that number matches what's happening out in the community.
That's right.
We had a couple days, about a week or 2 ago, where we actually had a significant number of employees who tested positive. That number has dropped in the last week or so, which is encouraging, and it could be for a couple different reasons. But one of the reasons we think is because we've had so many of our employees get vaccinated, and you wanted to talk about that.
So Dennis, as you pointed out today, only 3.5% of the employees that were tested yesterday were positive.
Right.
Significantly below the community and significantly below where we were 7 to 10 days ago.
Right.
Now, we've vaccinated about 7,000 of our 9,700 employees. So that's, you know, over 70%. And we're now in the 5th week. So perhaps some immunity is starting to kick in our employee base.
And without getting into one vaccine versus the other, because they're both excellent vaccines, in point of fact, you can get a significant immune response even after the first dose, correct?
That's right, Dennis. In the study from Pfizer, it was a little over 50%. And in Moderna, it was actually broken out by age group. In the 18 to 55-year-olds, which is a big chunk of our population, it was 95%.
Right. And we know ultimately after you get both vaccines, you're over 90%.
Well
which is
over
great.
90, 94, 95%.
So we continue with the vaccine efforts. We'll talk more about that in a couple minutes. Staff redeployment, Fred. We've talked about the resiliency of our staff. We talked about their willingness to take reassignment and redeployment to other parts of the hospital in order to allow us to balance load that internally. And I think primarily we wanted to thank our workforce for that and call out those efforts because that's really important.
It really is. So for those of you who have been redeployed, personally I thank you.
Yeah.
It's very, very important to our mission. That all started on Monday.
Right.
I think it's going well. I think we need to continue to do some follow-up with that staff,
Right.
make sure that they have all the tools and knowledge they need to be successful in their redeployed positions. But Dennis, it's very important, and we really do owe them a lot of gratitude for what they're doing.
No question about it. And I think we can all agree that we look forward to the time when they can go back to the designated units that they come from,
Absolutely.
because that means that we've gotten over this and we're back to business as it was before the pandemic.
That's right.
Fred, we often talked in the beginning of the pandemic about what tier we were at as far as our staffing plans.
Yes.
And you can correct me if I'm wrong, but I don't think we ever got above tier 3 back in the spring.
That's correct.
So we break this down into those medical surgical beds as one group and then ICU beds as another group. So before I ask you to tell us what tier we're at, I heard you on the radio today, and the message I heard from you was that, whatever the volume is, we're managing it through the techniques you're describing. We're still able to care for the patients in the hospital, which I thought was a great message to the community. Where are we with med-surg bed tier level right now?
So Dennis, we're at tier 5.
Okay.
So significantly higher
Right.
than where we were in the spring. So as I said on the radio, we are managing. We are caring for all those patients. It's about 120 patients on our med-surg
Right.
floors. Now, you remember, some of them are COVID positive but not infectious.
Right.
So they're handled a little bit differently. But, I think that we're in an okay place.
Good. How about ICU? What tier are we for ICU?
So interestingly, Dennis, we're only in tier 2.
Tier 2.
So we continue to see this dissociation between the med-surg population and the ICU population, which is good. So today, only 18 patients in ICU. During this particular surge, we've been as high as 29, I think, somewhere
Right.
in that range. So substantially below not only the spring, but substantially below where we've been earlier in this surge.
And as an academic medical center that takes lots of transfers and people who often need our intensive care units, it's good to know that we're still at tier 2 there.
Yes, absolutely.
Okay.
We have capacity for those non-COVID
Right.
ICU patients.
Right. Let's shift gears. Let's talk about vaccinations. There's got a lot to talk about here, and we'll get through some of it today, and we'll pick some of it again tomorrow.
Okay.
Let's start with some really good news. So in the capital region, the Regional Vaccine Network has actually administered over 40,000 doses of COVID
tremendous.
vaccine to the region.
That's
Incredible work.
tremendous.
All the area hospitals, county health departments, qualified health centers doing things. Fred, numerous examples of really remarkable work. I know the Albany County Sheriff Apple, set up a pod this weekend and was doing a drive-through. Lots of examples that we could call out there. Great work happening by people. So that's wonderful news. The story is changing quickly.
Yes.
Right? So on Friday, we heard that the new eligibility included people over the age of 75. Yesterday, we heard that included people over the age of 65. A lot of this is because the federal government is now releasing more vaccine, and so they're obviously increasing the eligibility. The most important thing, if you're listening, is there's a website. And maybe we can put it on the screen here too, capitalregionvax.org. As the story changes, as the information gets updated, that's the best place really to get the information.
Yes.
Another thing I'd like you to know about is the phone number. Allow me to read this, but again, let's put this up on the screen. So it's 1-833-NYS, like New York State, the number 4, and VAX. And that's the phone number, Fred, that people can call basically to begin to schedule appointments to get vaccinated. We're hearing that the vaccination pods, it's a couple weeks out to get vaccinated.
It absolutely is. I think people need to be patient, Dennis. It's going to
Right.
be a little hard to get through right
Right.
now, but it's a very, very important thing that people get vaccinated.
So people call you, people call me.
Yes.
I think the important message for the public is we're not sitting on vaccine. When we get vaccine, like all the area hospitals and county health departments, it gets used within the week we get it.
That's right.
We certainly expect there's going to be much more vaccine in the weeks ahead, but I think your caution to be patient is a good one.
Yes.
It's encouraging that people want to get vaccinated.
Absolutely
And we're
is.
working as hard as we can to get more pods set up, including the one at the SUNY site, but we do need to be patient.
Yes.
On that website, capitalregionvax.org, there's also a link called Am I Eligible? Click on that link, start filling in the information, and it will give you some idea about other locations now and in the near future that might be places you can get vaccinated. So while we bring you information here in between videos, it's really a very good place to go.
It's great.
It's a great place to go. And Fred, on this campus, we have a number of people that have now gone through their second vaccine as well,
That's right.
correct?
Over 1,000.
Over 1,000. And so if you got a vaccine at any location, the expectation is you go back to that same location to get vaccinated the second time.
You'd go back to the same location and you need to get the same vaccine.
Right. And that's an important message because obviously people have been going to a lot of different locations, and in the future, that's where you need to go back.
Yes.
All right. So I think we can talk more about vaccine in the next couple of days.
I'm sure there'll be more news tomorrow.
I'm sure there will be. But the good news is, congratulations to the Capital Region. We're well on our way to 50,000,
That's
which
tremendous.
is great news.
Tremendous.
All
Great
right.
effort.
So,
Great effort and great leadership, Dennis.
same. Thanks, Fred. Thank you. Okay. We will be back again tomorrow. So we one day in between,
Yes.
just like the good old days.
That's right.
So we'll see you then. We ask that you once again please take care of yourself, take care of each other, and we'll see you tomorrow.